The skull in the skeletal system protects the brain and supports the face. It is subdivided into two sections, the cranial vault and the facial bones. I will be focusing on the cranial bones of the cranial vault. There are 8 cranial bones, the 2 paired parietal and temporal bones, the single frontal, occipital, and sphenoid, and the ethmoid bones. In blue is the parietal bone that comes as paired bones, located on the upper lateral right and left sides of the skull. Both bones are connected together by the sagittal suture. In red is the temporal bone, which is also paired bones found on the lower lateral of the right and left sides of the skull. Found inferior to the parietal and frontal bones, it has many regions. The squamous portion is on the upper region of the bone and is flat. Below that is the zygomatic process, which forms the posterior of the zygomatic arch. The anterior region is the mastoid portion, where the mastoid process is located. It attaches to the muscle. And on the interior side of the mastoid portion is the petrous ridge, where there are small cavities that house the middle and inner ear. On the exterior side, the external acoustic meatus is the large opening to the ear canal, and within is the internal acoustic meatus, which is found medial to the posterior ridge and inside the cranial cavity. The mandibular fossa is found anterior of the external acoustic meatus and at the external base of the skull. It joins with the mandible as part of the temporomandibular joint, which allows movement of the mandible. Anterior to the mandible fossa is the articular tubercle part of the temporomandibular joint. The styloid process is inferior to the mandibular fossa. It attaches to the small muscles and ligaments. The stylomastoid foramen is a small opening, and it is between the styloid and the mastoid process, where the cranial nerves supply the facial muscles. The carotid canal is a passage through the base of the skull where arteries supply to the brain. In purple is the frontal bone, which is found in the anterior midline of the skull, where it forms the forehead. The depression between the eyebrows is called the glabella. The supraorbital foramen is found on the supraorbital margin of the orbit, which is above in the eyebrows, where there are sensory nerves that passes to the forehead. In green is the occipital bone. It is posterior on the skull. On the midline of the bone is the protrusion of the external occipital protuberance, which is where ligaments attach to connect to the posterior of the neck. On either side of that is the superior nuchal lines, where the muscles on the neck connect to the skull. On the base of the occipital bone is the foramen magnum, where the spinal cord exits the skull. On the side of the foramen magnum is the occipital condyle, where the first cerebral vertebrae joins to support the skull. In yellow is the symphoid bone. It is the central bone of the skull base. It joins with most of the bones of the skull. The bone is shaped like wings of a bird, called the lesser wings of the symphoid bone, that form the lip of the prominent ridge of the temporal bone. It comes between the anterior and middle of the cranial fascia. The stella turcica is midline of the cranial fossa, and on the floor of it is a depression of the hypophyseal fossa, which houses the pituitary gland. On the inferior portion of the skull are the medial pterygoid plate and the lateral pterygoid plates, which form the posterior walls of the nasal cavity and where muscle attaches for chewing. In orange is the ethmoid bone, which forms the roof and the lateral walls of the upper nasal cavity, the upper nasal septum, and the medial wall of the orbit. The perpendicular plate forms the upper portion of the nasal septum in the nasal cavity. In a small area of the floor of the anterior cranial fossa and the roof of the nasal cavity are where the casta galli and the cribriform plates are found. The crista galli is the projection midline of the bone, where it attaches to one of the layers of the brain. On either side is the cribriform plate, where there are many small openings of the olfactory foramina, and nerves enter the brain due to the olfactory. Between the medial orbit wall and the upper nasal cavity, the ethmoid bone forms several air-filled pockets of the paranasal sinus. And those are the 8 bones of the cranial cavity.